Diabetes is a very common condition in our country. Where the diabetic capital. And as you saw in the Trivandrum study, there are several patients who are having diabetes also, and some nephropathy also. Now, it has been shown that ARNI may be useful. Of course, it's very well known it protects the kidneys and all. Initially, there may be an increase in the creatinine or the slight decrease, but later on, it protects the kidney because the uh, uh, patients who need renal replacement therapy are much reduced. So it is a renoprotective, but can it protect type 2 diabetes? And do we believe that ARNI has ancillary benefits in new onset diabetes and reducing need for insulin? Yes, there are studies to show that it may be useful, especially in diabetic patients. This is again an Indian study, same Trivandrum heart failures registry, in which 55% of patients hospitalized for heart failure had diabetes mellitus. And this is a pretty high percentage. It's true in the rest of the world also, where up till 30 to 40% may develop heart failure with the diabetes. Now, it has been clearly shown that in diabetic patients with heart failure, if you use guideline-directed medical therapy, the mortality and rehospitalization is markedly reduced. This is the Indian data that patients who are given guideline medical therapy, the reduction is much more than otherwise also. So it's very, very useful in a diabetic patient. And there is a reduction in cardiovascular death by 20%, heart failure hospitalization 20%, similar to what has been shown in non-diabetics also. So irrespective of hyperglycemia, there is a reduction in mortality and improvement of quality of life. Actually, this may be better. And seems to be additional benefit that the glycemic control may be better. This is a comparison with enalapril. You can see that the HbA1c decrease much more than with the enalapril in diabetic patients, and also it may have some anti-diabetic. And some studies have shown that new use of insulin was 29% lower with the ARNI versus enalapril, and fewer patients were started on oral therapy with ARNI on oral hypoglycemic agents. So in other words, this can decrease the use of insulin also in these patients. So it seems that ARNI is especially useful for diabetic patients, which are in plenty in our practice and which occur in quite large number in our country. So I think for diabetic heart failure, this seems to be a very, very good drug. Not only it improves the heart failure, but it may improve the glycemic control and insulin sensitivity also.